One of the challenges also, Professor Khanna, and I'm sure you discussed this in business school, is enhancing skill development. Whether it's at the private primary health centers, ASHA centers, how do you improve the quality and the skills of people at the bottom, in a sense, of our public health infrastructure? Do you believe skill development needs a much more robust investment in educating lakhs and lakhs of health workers across this country? And that is, again, something that will require huge amounts of finances.
Yeah, so again, Rajdeep, I mean, I'd certainly agree. I'm not minimizing that this is going to take a lot more rupees than we have traditionally allocated to it. But I think one of the things that we learn in business schools is that a lot can be done through organization and management that's much, much better. As Vikram just said, there's so many models around the world that have addressed even these issues. So, for instance, this concept of task shifting, right? Because we have relatively scarcer medical personnel at, shall we say, higher levels of training than you do community health workers or you do nurses and nurse practitioners. And as you move up the amount of time that it takes to skill different people, there are ways of making sure, setting up, if you will, governance protocols within the actual delivery of healthcare that allow you to shift tasks away from relatively scarce buckets of human capital towards things that are more easily available. And that's not, again, unique to India. It's true in most countries around the world. And also, one of the things we haven't spoken about, Rajdeep, in this brief engagement is the role of technology. Kiran had alluded to it in the beginning. But I think there really is sort of a step function change in decentralized point-of-care diagnostics and to some extent treatment delivery that's unfolding around the world. I see it in my own backyard out of my window right now in the Cambridge, Boston, not the Cambridge, England, Cambridge, Boston medical ecosystem, right? There's so much ferment and so much technology. Much of it can actually be adapted. I wouldn't say easily, nothing is easy here, but can be adapted in principle to the needs of countries like India. And much of it is actually being developed in places in Bangalore and other parts of India. So I'm very optimistic that with a combination of better models of management, learning from existing experiments and technology, we can make progress on human capital.
I just have a minute or two left. I want to give each of you 30 seconds to give us what is your big vision that you see for the future, and the one thing that you would like to see change in the years ahead to achieve this ambitious goal of universal health. You start, Dr. Shaw. The one thing, 30 seconds.
Well, I think we're all working towards an inclusive and reliable and trusted process where citizens will definitely get a fair deal when it comes to healthcare. So I think we're asking, the right questions. We want to get the citizens involved and really come up with a credible commission that can make a difference.
You keep saying citizens involved, so I presume you'll do a large-scale survey across the country, yes. Perhaps the largest that's ever been done?
No, what we plan to do is to really adopt a number of surveys, research, projects, and a lot of pilots to make sure that they can scale up.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.